Hi, my name is Jillian Hampton. I'm a graduate student through Tennessee State University. Today I'll be doing a presentation on the anatomical structures and physiological function of our larynx. So we'll begin by labeling all our parts of the larynx, as we can see right here. We begin with our only bone in the larynx, which is the hyoid bone, and it is connected to a membrane called the this is the pink part, the thyrohyoid membrane, which connects it to the thyroid cartilage. And the thyroid cartilage is then connected to the cricoid cartilage, this white cartilage down here, by another membrane called the cricothyroid membrane. The cricothyroid cartilage is then connected to the trachea via the cricotracheal membrane, and here is our first tracheal ring. We also have two main joints, the thyrocricoid joint, as well as, which is where the thyroid cartilage meets the cricoid cartilage. And we have the second joint where the arytenoid cartilage meets the cricoid cartilage. For other cartilages, we have, again, as we discussed, our thyroid cartilage, our cricoid cartilage. We have two arytenoid cartilages, which we can see here in blue. Okay, so they are on both sides. Here's one, here's two. And on top of the arytenoid cartilages, you have what are called corniculate cartilage, which you can see here in purple. And on top of those sit two more cartilages called the cuneiform cartilages, which are embedded in the airy epiglottic folds. So we can also see on the back here, we can see our epiglottis right here, and the pink strips are representative of the airy epiglottic folds that those cuneiforms sit in. Okay, for muscles, we have several muscles that are very important for production of voice. On the front, we can see the cricothyroid muscles, which consists of a pars recta and a pars oblique. On the back, you can see the two interarytenoids. You have your oblique interarytenoids and your transverse interarytenoids. You also have a lateral cricoarytenoid muscle, which is on the side right here in purple. You also have a posterior cricoarytenoid muscle, which are these two red muscles right here. And as discussed, we have our cricothyroid muscle in the front. So the larynx, the primary function of the larynx is to protect our airway, but it is also helpful and will assist in respiration, phonation, and resonation of sound. Respiration is important for voice production in that as exhalation is taking place during that respiratory cycle for voice production, that is what is driving vocal fold production, is that exhalation of air. Now, in order to make phonation occur, there have to be several necessary and sufficient conditions to be occurring to bring that all together. And first, you need laryngeal adduction of these arytenoid cartilages, which means that the arytenoids are being pulled together in a way that the vocal folds are also being pulled together in the paramedian position. You also need medial compression of the vocal folds, so it means they're being pulled all together with some longitudinal tension. And you must reach enough subglottic pressure that sits underneath. So it's all that air that's being, that exhalation air is building up that pressure underneath those closed vocal folds, creating that subglottic pressure. And you need enough of that to cause those vocal folds to be blown apart. And it's the production of the subglottic pressure where respiration is the most essential. The respiratory component is that during that exhalation, the muscles of exhalation, along with the elastic recoil of the lungs, is causing a decrease in the volume of the thoracic cavity and driving up that pressure. And that pressure that's being built up is how we create the phonatory threshold necessary for phonation. So once that phonation occurs, we have what's called the myoelastic aerodynamic theory. And this means that the phonatory threshold causes those vocal folds to be blown apart. Air will rush through that glottal space. And when that happens, the Bernoulli effect comes into play on the vocal folds, and that there's an increase in the velocity of airflow and a decrease in pressure against the sides of the constriction or against the sides of the vocal folds. Once there's a drop of pressure against the sides of the vocal folds, there's no longer a sufficient pressure and will cause the drop or that decrease against the vocal folds will cause a decrease in pressure, enough so much that the vocal folds are no longer being able to be held apart and will then be sucked back together. Once that occurs and there's not enough sufficient pressure, that will begin to be built up. So again, that whole cycle will start again. Subglottic pressure will be built up. Once it reaches a phonatory threshold, it will blow the vocal folds apart, and the cycle will continue. And you can usually get about 100 to several hundred cycles per second for every time. Once that cycle of vibration has been set up and it's continuously going, you have what's called the mucosal wave. That is soft tissue that's being blown apart again, beginning at the inferior bottom lip across, going up and across the superior surface of the vocal folds. And that mucosal wave is the pattern of the vocal fold vibrating during phonation. Okay, there are several important muscles that we had, we've already labeled them, but we're going to discuss them in more detail. You have three main categories of muscles. You have adductors, vocal tensors, and abductors. So we'll start with the adductors. Remember, adduct means bring together. And you have two main ones, your interarytenoids. So again, your oblique interarytenoids and your transverse interarytenoids. You also have the lateral cricoarytenoids here on the side in purple. So the interarytenoids, these cause the arytenoids to come together. So muscles will contract, they slide across the top of the cricoid cartilage and are rotated in so that the vocal processes are also rotated together like this, and those bring the vocal folds together. So on our arytenoid cartilage, which is a little difficult to see, you can see that there are two main processes. You have your muscle process and your vocal process is this inner boot looking one. The vocal process is the one that attaches to the vocal folds or the thyroarytenoid muscles. Okay, so what this is talking about is that as they contract, they're going to slide across and this is going to rotate just a little bit like that, causing these thyroarytenoid muscles to come closer together and to approximate. In conjunction with that, you also have your lateral cricoarytenoid muscle, which is helping to pull this muscle process. And it's going to pull, as it contracts, it's going to pull that muscle process towards the outside, which is again going to cause these vocal processes on the inside to come together, helping those vocal folds come together as well. You have two main vocal tensors. The first one is the cricothyroid. Okay, again, in the front, as we talked about with the pars recta and pars oblique. Okay, this is the primary mediator of pitch, so very important for our pitch. Causes a decrease in the distance between the anterior thyroid and the cricoid cartilage, stretching those vocal folds. So that means that this thyroid is going to be rocked forward, okay, causing those vocal folds to then be stretched thinner, which is what changes the pitch. Okay, you also have the actual vocal folds called the thyroarytenoid muscles, which you can see in here, the V-looking shape in red are thyroarytenoid muscles. And those will help fine-tune pitch, as well as their primary concern is with sound production and its characteristics. And as we discussed when we were talking about the myoelastic aerodynamic theory and the mucosal wave, that's where you really see how the thyroarytenoids are very important, and that they are the ones that are being blown apart and pushed together and blown apart and pushed together with those vibrations and creating those cycles. Your main abductor, which means pull apart, is your posterior cricoarytenoid muscle. This is the only muscle, it's the only one, that will pull the muscle processes together towards each other, causing the vocal processes to be pulled apart, okay, allowing for that. Now there's one main nerve that innervates all of the larynx, and that is the vagus nerve, cranial nerve number 10. However, there are several branches of the cranial nerve. So as we can see here, we've got some nerves going on. There is one to each side. Okay, so the vagus nerve will come down, supplying all things laryngeal. Supplies this whole thing. All intrinsic muscles receive innervation from the recurrent laryngeal nerve, aside from the cricothyroid, and which will receive innervation from the superior laryngeal nerve. So this vagus nerve comes down and it begins to split. And you can see our split right here. The ones going into the thyroid cartilage, this green right here, on top and bottom are your two parts of the superior laryngeal nerve. You have an internal laryngeal nerve, superior laryngeal nerve, and an external superior laryngeal nerve. The internal superior laryngeal nerve is primarily sensory and supplies the mucosa of the valleculae, the epiglottis, and the laryngeal vestibule, all the way down to the level of the vocal folds. Then you have your external superior laryngeal nerve, which is the motor component and stimulates the cricothyroid muscles that we had discussed here. So these are the only intrinsic muscles that are being supplied by the superior laryngeal nerve. Now, apart from that, again, a second branch of that vagus nerve is our recurrent nerve. And the recurrent nerve actually comes down and it'll loop underneath the aorta and subclavian and then come right back up and attach into the larynx. And it is in charge of innervating not only the mucosal linings below the vocal folds, but the motor branch supplies all of the other intrinsic muscles that we've talked about, minus the cricothyroid. Okay. And that is my larynx. Thank you for listening.